The DSM-5 lists more than 500 mental disorders. Each entry describes the criteria for diagnosing the disorder and the key clinical features of the disorder. The symptom also describes features that are often but not always related to the disorder. The classification system is further accompanied by background information such as research findings, age, culture, or gender trends, and each disorder's prevalence, risk, course, complications, predisposing factors, and family patterns. The DSM-5 requires clinicians to provide both categorical and dimensional information as part of a proper diagnosis. Categorical information refers to the name of the distinct category or disorder indicated by the client's symptoms. Dimensional information is a rating of how severe a client's symptoms are and how dysfunctional the client is across various dimensions of personality and behavior. First, the clinician must decide whether the person is displaying one of the hundreds of psychological disorders listed in the manual. Some of the most frequently diagnosed disorders are anxiety disorders and depressive disorders. Although people may receive just one diagnosis from the DSM-5 list, they often receive more than one. Each diagnostic category also has a numerical code that clinicians must state, a code listed in the ICD-10. The effort to produce the DSM-5 took more than a decade. After years of preliminary work, a DSM-5 task force and numerous work groups were formed in 2006, with the goal of developing a DSM that addressed the limitations of previous DSM editions. Finally, in May 2013, the DSM-5, the new diagnostic and classification system, was published. The new DSM has raised concerns among many clinical practitioners and researchers. Critics worry that some of its changes in criteria and categories are ill-advised and will lead to problems of various kinds for clients. The DSM-5 changes that have raised the most concern include the following. It calls for a diagnosis of major depressive episode for some recently bereaved people. It adds a new category, premenstrual dysphoric disorder. It adds another new category, somatic symptom disorder, that can be assigned to people who are overly anxious about serious medical problems. It combines the patterns of substance dependence and substance abuse, patterns that may each require different treatments. They combine it into one single category, substance use disorder. It groups the category gambling disorder as an addictive disorder alongside the substance use disorders. It combines all forms of autism into a single category, autism spectrum disorder, thus eliminating the past category of Asperger's syndrome. It adds a new category, mild neurocognitive disorder, that could be misapplied to normal age-related forgetfulness.